What's up? It's Khadija here with Nursekayexplains. This resource that I have here for you all today is completely free, and most of all, it is fun. I think that is very important because for a lot of students, we all learn different ways. Some people are auditory learners, some people are visual learners, but this is a great way to practice, and it mimics what you will see in the real world. Skillstat.com is a great resource to help you practice your arrhythmia. They have 3 simulators, and the first one I'll pull up on the screen is ECG 360. So you're going to go to skillstat.com, you're going to go to your right hand side and go to little hamburger and select ECG 360. So as you see on the screen here, this is a little game that they have. They, throw arrhythmias there, and you have 60 seconds to guess as many as you can. It's a fun way of learning your cardiac arrhythmias. And I like this because it also have rationales. Like I said, they have 3 simulators. So the second one they have is practice and play. Now this is somewhat similar to the first game that they have, but this is a little different because you can have more time. You can select the amount of time you would like to play, as well as if you would like worded problems or just strictly arrhythmia. I like this one as well. Also, it feels like a game. You're pressed for time. And I think this is a good skill to, utilize because in the real world, when you have a patient, say for instance, if they go into 3rd degree heart block, you have to be able to recognize that. You don't have time to sit there and look through and Google and all this other stuff. You have to know it. And that's why a lot of times when you do an ICU residency or a telemetry residency or what have you, they have you do an EKG test prior to you, advancing through your residency program. It's very important, especially your lethal rhythms. Do not go into them people's hospital, y'all, and not know your lethal arrhythmias, okay? But you're gonna get it, and this is, like I said, a great way to practice. This is great for new graduates as well as nursing students. Now, the 3rd simulator that they have is Rhythm Deck. Now, this is one that's a little different. This isn't like, a game or a problem where you have to guess as many arrhythmias as you can. This is a little different because this one, you select the arrhythmia that you want to see, and they will give you an example of that as well as different variations. So if you're like, oh, I can't remember what AFib, looks like. I can't remember the rules to that. So you can just select AFib, and it will show you, what AFib looks like as well as a different variation to that. They also have like acute coronary syndromes, as well as, true EKGs. So I really like this. This is a great resource, like I said, for nursing students and new graduates, whether you're just learning arrhythmias or you know them, you're prepping for Nclex, or you're prepping for your residency program to go into the hospital. I like this because, like I said, for me, turning things into like a puzzle or mimicking a game was very beneficial for me when I was learning, and I think that it works for a lot of other people as well. So if you're one of those types of learners where, doing a game or, practicing like a simulation, this would be great for you versus like, just strictly doing a textbook. Of course, if you like other tips, tricks, and hacks, you can follow me on all my social media pages. I frequently post, tips, tricks, hacks to help you, navigate through nursing school, pass Nclex, and transition to the bedside. Of course, you can always email me, comment, DM me. I try to respond within 24 hours to all of your inquiries. You can go to my website and get your free ebook, as well as, Nclex workshop if you need help with that. So I have the links down for that below. I also have, the links for the Amazon store, some great resources there that I feel like, have really helped nursing students in the past, pass their Nclex, which relates to the nursing program. So I do have a live Q&A coming up, guys. So make sure you're there. I hope to see you all soon.